Hello and welcome. This is Dr. Peter Nixick, resident at the University of Wisconsin, Division of Plastic and Reconstructive Surgery. On behalf of the Pore Lab, we would like to thank you for watching our supplemental video on end-to-end anastomoses using the top and bottom two-stay method, performed by Dr. Wei-Fang Zhang. This video will cover Lesson 6B of the Microsurgical Training Manual, top and bottom two-stay method. Similar to the two types of back wall first anastomoses that were covered in Lessons 5 and 6A of the Microsurgical Training Manual, this method allows you to perform end-to-end anastomoses in situations where the donor vessels and pedicle are not long enough to flip 180 degrees to expose the back wall. The first stitch is thrown in the surgeon's forehand in the middle of the back wall. The second throw of the first stitch is also in the forehand, in the opposite vessel in the middle of the back wall. The first stitch is identical to that of the alternative back wall first method. The second stitch is thrown in one from right to left in the middle of the front wall. The vessel is then turned 90 degrees using the suture tails that were left long from the two stay sutures. It is important to keep the tip of the needle parallel to the vessel to prevent backwalling. With the needle inside of the lumen, place the vessel on top of the needle with your forceps. This will prevent backwalling as well and ensure that the bites are equal between vessels. Then use the divide and conquer interrupted suture technique to complete the rest of the front wall of the anastomosis. When the front wall is done, the vessel is then rotated 180 degrees to expose the other side wall. The second side wall of the vessel is then completed identically to how the first side wall was sewn, using an interrupted divide and conquer method. When the second side wall is complete, the double opposing Acklin clamps are removed, and in the blue blood chicken thigh model, methylene blue dyed saline is then ran through the anastomosis to check for leaks and patency. This concludes Lesson 6B of the Microsurgical Training Manual. Thank you.